Remember, synovial joints allow for a wide range of movement. So let's take a quick look at some of those types of movements. A gliding movement occurs when relatively flat bones move back and forth or side to side between each other. So remember, a joint is where bone meets bone. So here would be bone, and if this bone is moving back and forth, or this bone is moving side to side, these bones are moving in a gliding motion. So this happens most often in the bones that make up the carpus, or what we commonly call the wrist. You also see some of this in the plantar bones of the foot. Angular movements are going to cause an increase or decrease in the angle between the articulating bones. The principal angular movements are flexion, extension, and hyperextension. So flexion results in a decrease in the angle between the articulating bones. Extension results in an increase in the angle between the articulating bones. Hyperextension is a continuation of extension beyond what would be the normal anatomical position. Now, a lot of joints prevent this from happening by the arrangement of the ligaments that hold those bones together, or also the anatomical position of the bones. So it's hard to hyperextend your elbow because of the way the bones are made. However, you can hyperextend the shoulder joint simply because you are able to increase that range of motion to move it beyond the normal anatomical position. So let's look at these flexion and extension here using the elbow joint. So to flex, you are decreasing the angle of the joint, bringing the lower part of the arm toward the shoulder. And when you extend the elbow joint, you are extending the angle of that joint and moving the lower arm farther away from the attachment point. If you abduct someone, you take them away. So abduction, A-B-D, abduction means to take away from the body. So if you raise your arm out to shoulder height, that action is abduction. If you kick your leg out to the side, moving it away from anatomical position, that is abduction. Same thing with the hand. Take it away from the body, abduct. So abduction of the wrist joint. And the same thing with the fingers. Take them away, out is abduction. If you add to something, you bring it to. So adduction is to bring something back. So you're taking that joint and causing movement to bring something back to the body. So movement of a bone toward the midline. Circumduction is an action that refers to the movement of the distal end of a body part in a circle. So if you're moving the shoulder joint in a circle, it's not the shoulder that's moving, it's the distal end of that body structure that is moving in a circle. Circumduction of the lower limb or of the hip joint, you are moving that foot around. All right, so now let's look at rotation. Rotation involves a bone revolving around its own axis. So you have two of your vertebrae that are located right below the base of your skull are your atlas and your axis. And the axis provides a pivot point for rotation. So when you're shaking your head back and forth like you're saying no, that is rotation. If the anterior surface of a bone of a limb is turned toward the midline, then that's called medial rotation. So you can see if you begin with the arm in correct anatomical position and you rotate it toward the midline of the body, that's medial rotation. If you rotate it out, that's lateral rotation, and same thing with the hip joint. All right, let's look quickly at some specialized movements that only occur in certain parts of the body. So elevation, think about riding an elevator. You're going up. So elevation is the movement upward of a body part, and depression is the movement down of a body part. So if you move your mandible, your lower jaw down, that is depression when you open your mouth. And then when you close it, you elevate that mandible back up. Same thing with protraction and retraction. If you push your lower jaw out, that is protraction, so moving forward. Retraction, you pull it back in. Inversion is the movement of the soles of the feet medially at the intertarsal joints, okay, so the joints of the ankle, so that they face away from each other, okay. So inversion, I'm sorry, I don't like the way this picture is showing it. Okay, so inversion, you're rotating in toward the midline of the body. Eversion, you're rotating out to the lateral aspect, okay. So how do you know which is which? Look at the toes right here. Remember, your big toe is going to be medial, so rotating out, eversion, rotating in, eversion. Okay, dorsi means toward the back, so dorsiflexion is bending the foot at the angle in the direction of the back, so toward the superior surface. Plantar flexion is movement of that ankle joint toward the sole of the foot. So plantar, down toward the ground, I guess you could say. Dorsiflexion, back toward the back. Supinate and pronate is a movement of the forearm at the proximal and distal ends of the radius and ulnar joints. So when you supinate, your palm is turned up. So think, supinate, my palms can hold soup. Okay, you got to create a little cup there, right? Pronate, you turn the palms toward the ground. So think of playing pro basketball. You've got to turn the palms down to dribble. And opposition is the movement of the thumb at one of the carpometacarpal joints. Carpometacarpal, that just simply means hand and wrist, right? So you're moving the thumb across the palm to touch the tip of the finger on the same hand, and that is known as apposition. Excuse me, let me correct that. Not apposition, opposition. Man, when you talk this much, sometimes your words just get all jumbled up. Okay, on the next couple of slides, maybe 2 or 3 slides, you simply have all of this written down for you now. So you've seen some images of what gliding and different types of angular motion are. We've talked about rotation and special movements. So now you have this in a nice table form for you as well.